So good evening, everybody, and welcome to this evening's webinar. My name is Scott Lucy. I am the Business Development Director for Dualife for the UK and Ireland. And I'd like to start by giving you a brief background with regards to Dualife's association with the World Healthy Living Foundation. Dualife is the founder and funder of the foundation since its inception back in 2015. The foundation promotes education in the field of healthy living, inspiring individuals to take good care of their health and improve the quality of their lives. We'd love to hear from you wherever you're joining us from, so please put your name or your city or country into the chat below. And as you can see, the foundation has been in existence for almost 8 years. With the support of our experts, the foundation communicates through a variety of education solutions, including publications, lectures, and practical classes. Now, you can connect with the foundation through our Facebook pages and follow us on Instagram. So it's my honor and privilege to introduce to you our expert speaker this evening. It's Dr. Dorian Dugmore from England. Dr. Dugmore is the founder and CEO of the Wellness Academy. He has a PhD in cardiovascular medicine and is recognized internationally as an expert in cardiovascular health, preventative medicine, and wellness. During his long and impressive career, he's initially played and coached football internationally. He's run 26 marathons, was program director for the world-famous Toronto Rehabilitation Center for recovering heart patients. And he built the award-winning Adidas corporate wellness program, as well as Fit to Manage program for football managers, and served as the nucleus for sport cardiology in Europe. His wellness programs have achieved both national and international acclaim. So welcome, Dr. Dugmore. Over to you, sir.
Thank you very much, Scott, and good evening, everybody. It's a real pleasure to speak to you again this evening. And the title of our webinar this evening is Sleep, the Pathway to Well-Being. And sleep is very, very important. And if you don't get enough sleep, it can be influenced by a number of factors: diet, exercise, stress levels, lifestyle. So if you eat too much food close to trying to drop off to sleep, that will deter you to sleep effectively, because your body's trying to satisfy two masters. It's trying to wind down and relax, and at the same time it's trying to process food, which is two tasks trying to be delivered at the same time, which can make sleep and recovery quite difficult. Exercise as well. Exercise is very, very important, but if you exercise too closely to the normal hours that you go to sleep, then your body can still be wide up and ready for exercise. And it takes 4 to 6 hours for your body to slow down and rest and recover. So exercising too close to going to sleep can cause you problems. If you go to bed and you're very, very stressed, then all the chemicals that are associated with stress are flooding through your body, things like adrenaline and cortisol. What is that doing? It's wiring you up. And of course, your ability to relax and fall asleep will be compromised. And then a lifestyle that has lots of things going on and very, very busy all of the time can again affect your sleep. Although a lifestyle, a busy lifestyle is necessary in everyday living, but putting all those things together, you can have all sorts of challenges when you're stressed. Sleep then can be affected by your mental well-being, your emotions, and of course your physical performance. So that's so important to take care of those factors. So the fast pace of life means that a lot of the millions and millions of people are sleep deprived. They don't get sufficient sleep. And it's so important, as you will see during the webinar, that you do get plenty of sleep. If we move on to the next slide. So sleep deprivation can lead to failures in various systems in the body. And one of them is your immune system. Because if you don't rest and recover, then your ability to fight off infections through a lot of the hormones that protect you can be compromised. Sugars can become rift in your body, which would increase your diabetic risk. Because again, sleep is so important for cell repair. And people don't realize that when we go to sleep, that's the time when your cells repair, your cells rejuvenate, and your body has chance to recover. And people don't realize that that is so critical for effective sleep and for effective cell repair. Other things that can happen if you don't get sufficient sleep is it can accelerate the production of cancer, particularly through production of a thing called free radicals, which are the sort of molecular outlaws that are associated with cancer. Putting on too much weight can lead to obesity. And if your body isn't spending enough time recovering and repairing and rejuvenating, then it can help to store excess fat. And then, of course, heart disease can be a problem if we don't get time for our bodies to repair, particularly the heart and the circulation. So that can be compromised. And then if you don't get enough sleep, then people have more susceptibility to things like being depressed and affecting their memory. And memory is a very, very important part of health and well-being. So all of those things can be compromised without sufficient sleep. So one night of sleep deprivation can raise your insulin levels and your resistance to using insulin quite dramatically. And insulin actually promotes the use of sugars and the burning of sugars and the acceptance of cells to use sugars. And if your cells in your body are resistant to the insulin helping to control and burn the sugars, then again, risk increases with respect to the other diseases I described, and particularly to type 2 diabetes, very often referred to as adult onset diabetes. So important for sleep to help you avoid the insulin resistance. One of the things that's considered to be your marker of aging is your telomeres. And your telomeres are like the plastic bits at the end of your shoelaces. And as we age, those little plastic bits, like the end of your shoelaces, tend to disintegrate and decay and shorten. And that's associated with shortening length of life. And so those telomeres that are at the end of your chromosomes, and there are 23 pairs of chromosomes in your body, and they are your DNA, your cellular structure, the chemistry you've got from your parents. So the telomeres, as they shorten, can affect the aging process and really speed it up. And so you want to look at keeping your telomeres very, very healthy. And one of the things that will support you doing that is getting sufficient sleep and giving all of your body systems chance to repair and recover. So important again for sleep. So when we look at sleep, there are various cycles associated with sleep. And so when we start to fall asleep and we're almost still slightly awake, the green bits at the top of the slide as you're looking at it are the premature parts before you really start to relax. And then the next stage that goes into the sort of light sleep stage and the yellow stage is called REM sleep. And REM sleep, REM stands for rapid eye movement, is often associated with dreaming and dream sleep. And what's happening is as you begin to fall asleep and you go into REM sleep and then light sleep in the orange, your heart rate is slowing, your respiration, your breathing rate is slowing down, your temperature is starting to drop, your muscles in your body are starting to relax, your nervous system is starting to balance itself out, and your body is now moving towards the resting stage and the repair stage. And then you go into what is called deep sleep. It's called delta sleep. And that's when you get the most effective parts of cell repair and rejuvenation and recovery. And so, so important. So when you go through a complete cycle of light sleep to REM sleep to delta or deep sleep, that process for one complete cycle takes about an hour and a half. And then you go through to another cycle. And an ideal night of sleep contains around 5 of those cycles. So what are we talking about in terms of time? We're talking about 7 to 8 hours worth of sleep. And when people compromise that, what they're doing is they're compromising the ability of their body to recover, for the cells to repair, and to get ready for the next day. So cutting short on sleep can carry with it a cost. And increasing research now is suggesting there is quite a close association between things like dementia and Alzheimer's that are linked to not getting enough sleep. There's a very famous case in this country of our Prime Minister some decades ago, Maggie Thatcher, who used to compromise, who used to pride herself, on having only 4 hours worth of sleep. And yet she ended up with Alzheimer's and dementia. So it's so important not to compromise on your sleep. And that's very, very key to health. So let's move on to some tips to help you get better sleep. And there are a number of things that you can do to support your sleep. And the first one is to schedule sleep into your own project planning. And so it's a little bit like a lot of things in your lifestyle that you need to diarize and make sure that you cover and get enough of. And sleep is one of them. Just as diarizing exercise is one of them. One of the biggest tips I give to people when I tell them about optimizing their lifestyle is to make an appointment in their diary to exercise. Well, similarly, make sure that you at least plan to get, whenever possible, your 7 or 8 hours worth of sleep. So here's a question based on the previous slide that I showed you and about project planning for sleep. Is it a good idea to take a nap? Well, interestingly, naps can be quite beneficial, but you should only nap for either 20 to 25 minutes or at least an hour and a half. Now you think, why is that? Well, if you think about the sleep cycle that we showed you earlier, 20 to 25 minutes actually puts you in light sleep, whereas anything longer than 25 minutes starts to move more deeply into REM sleep and into deep delta sleep, repair sleep. And that whole process of one cycle takes an hour and a half. So if you are going to nap, either nap for 20 to 25 minutes, which is light sleep, or nap for an hour and a half, which is one cycle of light sleep, REM sleep, and delta sleep. And then when you wake up after either of those, you shouldn't feel too groggy. But if you wake up in the middle of delta sleep, when your body is trying to really rest and repair, you will feel groggy. So naps are okay, but either a shorter, sharper nap for 20 to 25 minutes or a longer nap for an hour and a half, going through a complete cycle of your sleep. So quite interesting when you look at that. So you should see sleep as a key part of effective work and of your health, other than an obstacle to working around. And many people, particularly in some quite famous professions, pride themselves on not needing a great deal of sleep, and they will then pay the price, as I illustrated with the example of Maggie Thatcher. Okay, move on to the next slide. So when we look at sleep and we look at the waking state, they revolve around a thing called your circadian rhythms. And your circadian rhythms are the normal biocycles that you live by as you go through 24 hours. So let's look at the waking state, 6 o'clock in the morning. That's when very often things start to change in terms of your body clock. And your blood pressure at about 6:45, 7 o'clock starts to rise. And a thing called melatonin, which is a hormone that's vitally important for sleep, that relaxes you and it helps you age effectively, gets produced during sleep, but it starts then to slow down at 7:30 in the morning. By the time it's 10 o'clock in the morning, then you've got usually higher levels of alertness right through till noon. Now, it's quite interesting. You know, very often people can either be what we call a lark, which is a person like the bird, the lark, that wakes up early and is very, very sharp in the morning, or they can be termed an owl. And that's people that tend to come alive and do their best work as the day gets longer. So are you an owl or are you a lark? It's quite interesting to look at the differences between the two. But normally the cycle is the one that we're describing and looking at now. So we get to noon, midday. By middle of the afternoon, around 3:30, that's when your coordination is probably at its best and your reaction times are at their best, because your body's had time to get used to the day and movement starts to optimize itself. And then by the time it's 5 o'clock, then your muscle strength probably is at its greatest and your cardiac efficiency is optimizing at its best. But by the time 6:30 comes, your blood pressure is probably at its highest, and your body now is starting to feel the effects and the pressures of the day. So by 7 o'clock, your body temperature is really at its peak. And then we start by 9 o'clock to start to produce more of the hormone melatonin that has the effect of relaxing the body, helping the body start to be prepared for repair, and helping your body to really slow down and relax. So the optimum period of time for producing melatonin, key for repair, key for anti-aging, is between 10 in the evening and 2 in the morning. And that's a typical cycle that we go through. And then we go on to the deep sleep, the big delta sleep parts that we talked about at 2 o'clock in the morning. Your temperature at 4:30 in the morning is at its lowest, and then we move around that complete 24-hour cycle to start all over again. And that's how the body works throughout that 24 hours. So if we look at the next slide, then that will look at some of the things that we've talked about that occur, that coincide with the previous slide. So at 6 o'clock in the morning, your melatonin starts to stop its production. You're getting really alert by 12 o'clock. Your reaction times and muscle strength in the latter part of the afternoon increases. And then by 6 o'clock in the evening, the light starts to dim and to change. Shortly, we move into British summertime. And so that light will extend a little bit. And some things that we shouldn't then do beyond about 9 o'clock in the evening, 10 o'clock, is spend too much time looking at computers, and the rays that come from those computers, some of the alpha rays, gamma rays, the blue light, can actually disturb your ability to fall asleep. One of the other things you should avoid, and it's mentioned there mid-afternoon, is after around 3 o'clock, you shouldn't really ideally drink coffee. Anything with high degrees of caffeine in it will keep you more alert than you should be as the day and the 24-hour cycle goes on. So a good idea is beyond sort of 3 o'clock, at the latest 3:30 in the afternoon, you shouldn't be drinking coffee. Well, that's quite funny, isn't it? Because when you go out for dinner at restaurants, what do they do at the end of your meal is they ask you if you'd like a coffee. And a couple of Americanos could be a really good pill for keeping you awake at night. So having lots of caffeine close to bedtime can affect your body's ability to relax, your melatonin production, your repair production. So just be a little bit careful of that. So quite an interesting look at your circadian rhythms and your circadian cycle. So some rules then of healthy sleep. Well, exercise, at least a walk on the right-hand side of the slide as you look at it, is important during the day because that will energize you. It'll produce oxygen that flows through the systems of your body and, you know, it really encourage good health. When you are going to sleep in the evening, then a cooler temperature is advisable. And your own body temperature will warm the bed up, but to go into a very, very warm temperature will affect the body's ability to cool down, to slow down, to repair itself. And so a comfortable, cool temperature is best. Things you should avoid in the evening are things like horror movies and working on computers, as we mentioned before. So any books that you read should be easy reading, relaxing reading that can actually calm you down rather than get you wired up. Keeping fresh air flowing through the room is very important because that, again, will help cool your body. And then towards the end of the day, getting through into a regimen of chilling yourself, calming yourself down, practicing some meditation can be very, very good for you and useful because that just helps to slow your brain down and help you relax before you go to sleep. One of the good tips that we give lots of people, and Dr. Michael Gray, the neuroscientist, recommends it, is if you are worried about things before you go to sleep, he calls it a brain dump, where you just get a simple notepad, write down things that you have issues with or worried about that you need to attend to the next day. Write them down, put them on your notepad, and park them away from the bed as if you're putting the troubles and worries and issues away to allow you to sleep quite comfortably. Some of the things that you perhaps shouldn't do with the red cross on there, I've mentioned coffee and tea. Alcohol is interesting. Alcohol, one drink of alcohol very often can relax you and slow you down, but too much alcohol and any more than a drink can very often help you fall asleep very, very deeply and then wake up throughout the night. And it can disturb your sleep. And so drinking alcohol too close to bedtime can, especially too much alcohol, can disturb your sleep. It can dehydrate you. And that can then really cause disturbances to your sleep. The same as overeating can do the same thing, as we mentioned earlier. So avoiding horror movies and action movies, getting away from your gadgets and your computers. Training hard before bedtime physically isn't a good thing either, because that will just wire your systems up and it will take you 4 to 6 hours to actually calm down and rest and recover. So those are the sort of don'ts, things to avoid before falling asleep. Okay, so moving on. Some more tips to get better sleep. Timing is key. And for good sleep, getting into a regular rhythm is so important. So trying to get a system where you go to bed at roughly the same time and do that on a regular basis with regular habits, maybe a warmer drink before you go to sleep, but not a drink full of caffeine, but some of the sort of more relaxing drinks. Horlicks is one of them with tryptophan, can help you relax. Because remember that the melatonin secretions, the anti-aging hormone, the relaxing hormone, is at its best between 10 o'clock and 2 to 3 o'clock in the morning. So getting a regular routine, getting a regular pattern can really help you sleep far more effectively. So that's a very, very good tip. Magnesium. Magnesium is, the body doesn't store magnesium effectively, but it's an anti-stress mineral which can help balance your blood pressure, calm you down, and often people are deficient in it. You can even get magnesium sprays. And so one of the products that Duolife produce, Physi-Easy, is high in magnesium, in potassium, both good for the systems and the heart in particular, and B complex, very good for your health and well-being. So magnesium is a very, very important hormone, a very important topical thing to take. So taking magnesium or a spray of magnesium is so important. There are other sprays you can use to go to sleep and to relax. One of them is lavender, and the effect of lavender and the smell of lavender has a really relaxing effect on the body and helps you to fall asleep. So that's another tip. Creating a sleep retreat. You can see the cat there with the dark glasses on. A lot of people actually sleep with some pads over their eyes just to block out the light, because the minute we get too much light, we stop producing effective melatonin. And so creating a comfortable sleep retreat is a very, very important thing to do. And so keep the office out of the bedroom. The bedroom should be a place for relaxation, for rest, for intimacy, but it shouldn't be a place where you're watching horror movies, you're working on your computer. And a lot of people ignore that and wonder why it's hard for them to fall asleep. Another technique is actually to avoid putting your mobile phone by the bedside, because the blue lights and the gamma rays associated with that can cause you problems. So create a relaxing environment. Sleeping in the dark is very, very important. So a darkened room and pulling down the drapes, the shades, the curtains, so important for your health and longevity, because then you're going to produce more melatonin, and that's the anti-aging element of your body that you really need to look after. That hormone really does help you live a long and healthier life. And so sleeping in the dark is so important. Another tip to get a better sleep: don't sleep with the clock facing you, especially if it's a clock with alarms that have white and blue light on them, because they will actually affect your sleep, just like the mobile telephone will do. So keep your digital clocks away from the bedside, because that will impact and disturb your sleep. Another important thing to avoid. Some good things, things like Himalayan salt lamps with a soft pink tint reduce the amount of negative ions. And negative ions stimulate the production of oxygen in your cells and your systems. And so reducing those effects with nice relaxing lamps like the one shown on the screen there can really help you get a good night's sleep. This is an interesting one. That when you exercise during the day, when general movement as well, you will get small micro tears in your muscle tissue. And the way that, for example, when you're exercising, muscles work is to have filaments that slide in amongst each other as muscles contract and extend. They're called actin and myosin filaments. And as they do that and they contract and they slide out amongst each other, they have like little ratchet systems in them, and you get very soft micro tears in the muscle tissue itself. And so those micro tears need time to repair. When do they repair? When the muscles relax during your 7 or 8 hours of sleep. And so these small micro tears can really get real benefit from the muscles relaxing and slowing down. And how many times have you perhaps gone to bed and felt a little bit stiff and your muscles a little bit tight, slight soreness? When you get up in the morning, it's gone. Why? Because your sleep has given you a chance to repair the muscles and the micro tears that occur in those muscles. So important to realize those things happen in the sleeping state. Now, when we look at early morning exercise, there's do's and don'ts about early morning exercise. Certainly, in terms of benefiting sleep, it will promote a 75% increase in more reparative sleep, repair sleep, according to a big famous study, Appalachian State study, if you take your exercise early in the morning, because then you're promoting your muscles to work and really encouraging them to repair themselves during the sleeping state. However, on the other side of the fence, one of the most dangerous times to exercise can be if you've got underpinning cardiovascular problems early morning. Because when you've been sleeping, the blood in your circulation can become a little bit thicker, coagulation times can increase. And so one thing you shouldn't do in the morning before exercising is literally get straight out of bed and straight into running. You need 20 to 25 minutes to allow the body to wake up before you contemplate exercising. And the other thing you should do if it's early morning exercise you're going to undertake is to have a little bit of toast with marmalade or some juice just to balance your blood sugars, because they'll have been disturbed as well during the sleeping state. So some little tips about early morning exercise. But a lot of people will get real benefit by doing that. Another tip to get good sleep is that if late night exercise we mentioned earlier can raise your core body temperature, and it'll take 4 to 6 hours for that body temperature to reduce. So the latest times really you should exercise really no later than 6 to 7 o'clock in the evening, and certainly no later than 8 o'clock, because then you're going to compromise your body's ability to repair and relax and recover during the sleeping stage. So that's a really important slide. Calm your inner chat for a sound sleep. One of the good things for you to do before you go to sleep is to practice some meditative techniques to really calm your mind down so that you can relax more effectively when you sleep. And remember, when we talked about stress and resilience a couple of webinars ago, we looked at these circles of control. The blue circle is any decisions and challenges you have that are down to you. The yellow circle is the one where it's not just down to you, but other people influence those challenges and issues. And the red circle is one that you have no influence over and nobody can really help you, and that's nothing you can really change. Don't spend your time worrying about the red circle so that you can park worries before you go to sleep. And that's just as a reminder that it's so key for you to to do that. So remember the brain dump, Michael Gray's tip about writing your issues and challenges down before you go to sleep. That's important too, to allow you to recover. And then we move on to the next slide. Another tip for good sleep, and I think we mentioned it in a moment, is to practice some vasovagal breathing. Before we get on to that, Jim Lear, in his book, The Corporate Athlete, says that every 90 minutes throughout the day, you should take a brain break. And that brain break should be where you practice some deeper breathing that just engages the endorphins in your body and switches off the likelihood of too much adrenaline or cortisol, the stress hormones that are developed in your body. So every 90 minutes throughout the day, take a brain break. And that will then help you when it comes to sleep time in the evening, get a better night's sleep. And move on to our next slide. So when in doubt, breathe out. Well, that's vasovagal breathing. We talked about it before. There's a nerve in the center of your chest called the vagus nerve, and it engages your body systems with your brain and helps you to relax those systems and get rid of the stress hormones in your body. And by deeper breathing in and out, you'll engage the vagus nerve that will then stimulate the production of endorphins and help you to relax. It's a good idea to practice that technique, particularly if you can't sleep. So breathing in for a count of 5 or 6 seconds and out for a count of 5 or 6 seconds can really, really benefit your overall relaxation and your ability to chill and to fall asleep. Okay. So another tip to get a better sleep, the vasovagal breathing that I just described. And to do that, you've got to be in the now. So it's about switching off. It's about ditching the worries, doing the brain dump, and being in the now at the moment, which will then allow you to relax and empty your brain and sleep far more effectively. So coming to the end now, there are a number of products in Duolife that can really benefit your sleep. And the natural one there is Duolife Night, with all of those wonderful vitamins and minerals that are shown and on the screen there. And Duolife Night, by taking that small shot glass of Duolife Night, will help you create more peaceful sleep, will help the cell degeneration, the cell regeneration that we talked about earlier, and it also enhance your immune system's recovery. Another one is pro-relaxing. That again is so important that will support your sleep. And the same with My Mind that we just whizzed through there. That will affect your memory and concentration and help that repair itself as you sleep. As will the next one, I think, is Pro Lumino. And that, again, will enhance your body's ability to fight against viruses and infections and repair during the sleep. And we mentioned Physi-Easy a little bit earlier, and that contains magnesium and all of the things listed there, potassium, the B vitamins, again, helping your body repair. So putting all those together, that will give you hopefully a really, really good night's sleep and some great tips there, hopefully, that will support and help you sleep more effectively. It's been a pleasure talking to you on the webinar, and hope you all get a really good night's sleep.
Oh, wow. Thank you so much, Doctor. I mean, I'm nodding off just listening to you. No, I'm joking.
Most people do.
It's really nice to go through these things. You really do sort of remind you of how important it is to kind of wind down at the end of the day. That's for sure. And so thank you so much from us, of course, here at Duolife. And we look forward to hearing from you. I guess you're coming back to here, talk to us again in May, I believe. And I think we've got
Yes.
an appearance, a live appearance from you on the 20th of April down in Milton Keynes. So for those of you who'd like to come and meet with Dr. Dugmore, that would be your opportunity. You can find out more about the World Healthy Living Foundation by writing to us on Facebook or following us on Instagram, and of course staying in touch with us here at Duolife for our ongoing meetings. So once again, thank you, Doctor, and look forward to hearing from you again soon. Take care, and thank you
My
all for
pleasure.
joining. Bye-bye.